We've spoken to the new provider kind of launching their peptide journey. Speak to the patient. What's a red flag that the patient should pick up on when it comes to their providers that are offering peptides?
This is a really good one. So a person's coming in saying, "Hey, I want peptides. Tell me what you think about it." And then the biggest red flag is there's no intake. There's no history, there's no medication or supplement review. How about labs? If you do not order labs for your patients, immediately that's a red flag. Immediately. Oh, here's a package. Here's your this package, then that package. Here's your libido booster package. Like, there's a problem because everybody gets the same dose. It's cookie cutter. And that means it's not meant for you. It's just something to sell. There's no monitoring. There's no follow-up. It's just like, yep, set it and forget it.
Yep, here's a little bundle.
Yep. There's miraculously no side effects, and there's a cure, and blah, 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 all the things that sound too good to be true, because that's true. You want someone who is more cautious than you are, not less.
Right. A red flag is if you don't check a baseline, then how are you going to track progress?
Absolutely.
You're not going to be able to.
The patient should ask, like, are there any human studies on this? Is it FDA approved or not? If it is FDA approved, there'd be an off-label use for it. But it's still supported by data. There's research on things. Now, research has different tiers, right? I can't get into that, but N of one, or is called like anecdotal. My friend tried this, and in clinical experience, that one person got better. That's not good. That's not good. Then you have clinical trials that are larger scale, and then if they're on multiple clinics that aren't connected, but the same study is done, that's wonderful. If it's human randomized, so some people are going to get placebo controlled trial, or it's double blinded, even better, and there are measurable before and afters, then we're getting better and better and better. And this is how the drug discovery and dissemination process happens in medicine. And that has really transformed all of healthcare for the better. You know, you have to think about what happened a century ago. There was no such thing as penicillin. This is all 100 years old. And we're just in this new version of that. We've all gotten the AI upgrade, if you will, but we're still relatively new, and it's so naive to think that one peptide is going to change your life when it's really your life that's causing the problem and it needs to be corrected.
You know what's so funny is I have my list of questions, and I've never had a conversation, one of these interviews, where I didn't stick to the questions, and you have completely made me. For example, my next question is for the perimenopausal woman who is fatigued with low libido and stubborn belly fat. What is your go-to cocktail? And I'm like, there is no go-to cocktail. There is my mind is completely blown by this conversation because I showed up to this conversation with what's the perfect bundle? What's the perfect package for a perimenopausal person? What is the perfect package for a man looking to get toned and increase muscle density and all this stuff? What's the perfect package for this person? And I'm completely transformed in this conversation because now I'm like, there is no ideal cocktail that is one size fits all. It's truly all customized. And so I'm kind of mind blown at this moment that I'm like, I don't even know what questions to ask because you have completely shifted how I think about peptides.
Well, good. I'm glad that this changed your course a little bit and helped to deepen or at least expand your knowledge on something that you weren't familiar with. But that's what we do. This is our discovery process.
It's really cool about this topic is that it is something that's been talked about as far as injectable peptides. Let's call it 2 years that it's really become conversation, right? It is such in its infancy, and it's going to be wild to look back on this conversation in 10 years and be like, oh my God, we didn't know anything, but we don't know what we don't know. So I think it's so exciting to see where we're going to be 10 years from now on the topic of peptides and what we're going to learn throughout the years and honestly the risks that we're going to see pop up that we didn't know about.
I've had a patient who came in yesterday and she's been on tirzepatide from said pharmacies that are questionable. She's lost no weight in a whole year. Nothing in 1 year. And she's on a pretty strong dose. Any questions that you might have? Is she getting what she's paying for? Because she's paying for it, but she's not seeing results. So I was like, okay, well, you can continue with that. I'm not taking you away from the person who prescribed that to you, but let's just talk about food. Let's talk about what's in your food.
Yeah.
No one's ever sat down and gone through what food is for her. Basics.
Yeah. What is your thought on should patients be able to purchase peptides by themselves? Like you
No,
can go on websites and purchase
I,
vials of peptides
I
easily.
do know that.
Easily.
There's no regulation on that at all. It's outside of anything regulatory pathway. But as soon as you inject something into your own body, ooh, now you've crossed into our territory. We are the healthcare providers that inject people with different substances. This is not like putting on a lotion or a potion or even taking a capsule, a supplement, because there's still the digestive barrier. Just because it's oral doesn't mean it gets absorbed, and we have defense strategies within the gut. Although it's a good delivery method for medications, but it's still a barrier. Your digestive acid is going to break down things, especially peptides. There's always workarounds, but I think that people should not be doing these things on their own. They're really opening up a can of worms.
I think the DIY trends on social media has just gone crazy.
I mean, how
DIY
comfortable
talks,
people
DIY.
feel like injecting themselves with filler. I host and I'm co-faculty with cadaver trainings. Oh my goodness. They have no idea. And when something bad happens, my heart is just so hurt. I had a gal come in, she had nose filler at a Botox party. Post rhinoplasty. She had a rhinoplasty already, and then she wanted a little bit more and went right up her forehead.
She okay?
She resolved. No vision changes. She just got very, very lucky. Because she could have completely gone blind and have been like, yep. So she got lucky on that one. But it was full on VO. Full on.
That is, I mean, we see it every day in our industry, and I think that's a topic in and of itself. So on the topic of peptides, what are you excited about in the next 5 years? Like, where do you see peptides going? What research is coming down the pipeline that you're really excited about? What gets you excited about peptides?
So on the skin side, I think we definitely have some really great things that are on the forefront as far as how to optimize the skin through different peptides and whatnot. That part's, I think, an easy win. That's very simple for us to understand. But on the metabolic side, everybody's metabolism genetically is a little bit different. Their mitochondria, which are passed down on the mother's line, are also a little bit different. Patients that have autoimmune diseases and things like that, we're going to be able to get more clarity on how to shift people's switches, their internal pathways. So for example, with GLP-1, I think it is a wonderful tool. If you and your entire family all rest at 100 pounds overweight, like that is not your fault. Like maybe like you and your best friend are growing up in high school and she's like skinny as a rail and you are just absolutely enormous according to all standards. Are you doing something wrong? Is that something to like sit there and lash yourself about? Like, no. That is that regulatory center in the hypothalamus. You deserve to be on this medication. It should be completely accessible and it should be free of charge. That's how I feel. So I think that what these drug companies are doing is really what is kind of the impetus for people to go and DIY this, because it is so absolutely expensive from these drug, and they're like, oh, we're lowering the cash pay price. I'm like, that's still too much. You go across the border and it's still slashed. It's just America. So that's one of the whys why people are going out on their own and doing this on their own. So as the prices will continue to come down, and if there is more accessibility, the people who truly deserve to be on this will be on it, and at better appropriate dosages. The FDA-approved dosages sometimes are too strong, and they need to be tailored, micronized, and just given to people to help do the job that it needs to do with good healthcare. As more providers understand the nuance of something that is still, when did it come out? 2021. Still very new. And
That's so crazy.
there's different versions. Even just in lowering cholesterol, the statin medications, the first ones are not used as much as the ones that we currently use. And they're beautiful because they don't contain that side effect profile that a lot of people are concerned about. And the dosage makes the poison with everything. So it's just being able to custom tailor. And as more research, actual research comes out, and large clinical studies show where things start popping out with, we get new novel ideas. This is where we can have a new indication. And that's good. This is science working for us, but it just moves like a glacier.
Yeah.
It
Yeah,
doesn't go fast enough.
we are Americans and want results yesterday. You're right. Like, I think we just need to sit with this for a second and just wait for some solid research to pop up to really comfortably understand the whole picture. Really, I think where we're at with peptides, we really only know a part of it. But like I said, we don't know what we don't know. And
Right.
as we learn, it'll evolve into understanding the full picture, and then it'll continue to be a bigger picture beyond that 10 years from now. They're going to look back and laugh at us about how we're dosing peptides
Yeah.
today, 10 years
Absolutely.
from now.
Absolutely. But, you know, youth is wasted on the young. You know, you're headstrong, you're egoic. And when you sit back and you look into the past, you're like, can you believe they used that stuff back in the day? I mean, there's so many examples that I can get into that are so comical.
It's like
But
injecting silicone in the lips. I just had a patient
yeah,
yesterday come in, and I'm like, oh my God, I can't believe they used to do that.
yeah,
And she has two large, like, her
they hang.
tubercles are, yeah. And it's
Breaks your
thankfully
heart.
on her, it's very, it sits really well, but she hates it. She absolutely hates it. But back then, they thought that they were doing something great.
Yeah.
And we fast forward to today and we're like, oh my God, the headache these days that we're experiencing with silicone in the lips. Fast forward 10 years from now, they're going to look back on this video and be mocking us about what
Can
we're
you
saying. And
believe
it's
we're even
exciting.
having to talk about this Wild West stuff? So we're going to see this delineation. We're going to see this delineation between providers, med spas that are going in for the cash grab because it's so apparent. And the more and more you see it, you're like, oh, please, yeah, you guys are fools. You're just in there
Yeah.
for the money. And they might sell it really, really well. But I'm going to be a provider that's always going to be authentic and stick to my guns. I'm excited. I'm
Me
excited, but
too.
I'm also going to hesitate. I'm going to take a just a little pause. I'm an early adopter, but I will not be the first in line. You
Yeah.
go ahead and mess all that up. I'm going to make sure that I'm practicing safely and effectively. It's so important for us to really be that healthcare provider that is honest, that's true, that fits within our morals and ethics. And don't
Hmm.
let money disguise that for you. Money magnifies people. And if you give people money, they do silly, crazy things. If I had millions and millions of dollars, I would just, how do I help the world better? Not myself. But I guess not everybody is on that side of
You.
the of me like I am.
Well, I think this space needs more of you in it, and I am so grateful beyond words that I've never had this like awakening during a conversation for my channel, and I'm so grateful that you've taken the time to share your expertise and also be humble enough to sit with the we don't know what we don't know. And I think that that's so incredibly powerful, and that's what makes you such a beautiful provider. And I'm just really grateful that you've had this conversation with me and my audience. So, if somebody were to try to find you, how can they find you?
All over social media, as you know, but on Instagram and TikTok, it's just my name, Dr. Steven Sorr, all one word. You can find me at Source of Health in Scottsdale. The website's mysourceofhealth.com. And then I have a training academy called Ultra Well Academy. So we have private trainings for providers, either in person or virtually, to help level up all of our skill sets so that we're all doing better and good things. Because we only learn from each other. We learn as we come together, not separate and divide and conquer. So that's really what I want to leave with is that we're going to do really well if we stick together and we stick to our good, logical, scientific minds and just practice with your heart.
That so much. Well, thank you so much, and I hope you have a wonderful rest of your day.
Thank you, Alexis. Pleasure.